This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
DPC is the way medicine should be. My first exposure to medicine was as a 5-year-old. My grandfather was a traditional herbalist Chinese medicine physician in Shanghai. And I was visiting with my family and I got some kind of illness. I wasn't feeling well. And all I remember, and this may not be an accurate depiction of what happened, but was I wasn't feeling well. And my grandfather gave me a horrible smelling concoction of something to drink. And the next day I felt fine. It was from then on that I decided that I wanted to be a physician to take care of people, to help them feel better. And from then on, it was my kind of dream. And I thought that, I would be someone that would be paid in chickens or whatever it was that happened back then. And I think instilled the morals and the ethics and the idea of what it's like to be a traditional family physician. So I always thought I was a old-time family doc in the new modern healthcare system, which we all know doesn't work very well. So it took me a long way to get here, but now that I'm in a direct primary care practice, I feel like I can practice the way that I want and the way that it should be, much like my grandfather did back in the day. So I'm Dr. Ingrid Liu of Progressive Health Primary Care, and this is my DPC story.
Dr. Ingrid Liu is the owner and director of Progressive Health Primary Care, PLLC. Dr. Liu earned her undergraduate degree at the University of Illinois, Urbana Champaign, her osteopathic medical degree at the Chicago College of Osteopathic Medicine, and completed her residency at the West Suburban Hospital Family Medicine Residency in Oak Park. Dr. Liu chose family medicine because no other specialty provides the variety of conditions managed, exposure to the complete lives of patients, and exposure to different cultures. Following completion of her residency training, she was part-time faculty at West Suburban Hospital Family Medicine Program. She was a partner in a small private practice, and later as a physician in a large multi-specialty organization. While her love of medicine continued, over that time she spent more and more time dealing with regulations and rules of health insurance companies and less time taking care of patients. To get more time for patient care, in 2014, Dr. Liu chose to make the leap to concierge medicine. She was recruited to open the first Chicago area office for Partner MD, a successful concierge medicine group based in Richmond, Virginia. It was a difficult decision to leave her large practice of 3,500 patients, but it was necessary to prevent quitting medicine altogether. The concierge model allows doctors to spend more time with patients compared to a traditional practice. And while she did have more time for patient care, concierge practices still accept insurance. She found herself still spending time dealing with insurance company rules and spending money on staff to bill insurance and deal with the inevitable headaches that brings. In February of 2020, yes, right at the beginning of the pandemic shutdown, Dr. Liu created Progressive Health Primary Care, a direct primary care practice in Oak Park. Dr. Liu is board certified by the American Board of Family Medicine, and she maintains memberships with the American Academy of Family Medicine, the American College of Private Physicians, the Independent Physicians and Providers of Illinois, the Society of Cannabis Clinicians, and the Illinois Women in Cannabis. Dr. Liu grew up in the suburb of Naperville, has lived and worked in the Chicago area her entire career, and her two daughters were born in Oak Park at West Suburban Hospital, the same place where she trained. When she's not caring for patients or volunteering, she enjoys running, travel, music, and cooking. Welcome to the podcast, Dr. Liu.
Glad to be here. Thank you for having me.
It's just incredible to hear your opening statement and hear that little story from your past and how impactful it was for you. I'm a person who believes that the people who have gone before us into another life are looking down on us and with us at all times. They might not be here physically, but it is such an honor to speak with you. And I'm sure that your grandfather is also so proud of you right now.
Yeah, it definitely had a great influence on me. That's for sure.
So your journey, like you alluded to, was rooted in this passion for doing quality primary care like you had seen your grandfather do, but also you mentioned how today's healthcare system that most people are used to in the insurance fee-for-service world is not allowing, well, most of us, if not all of us, to realistically follow through with our calling to why we went into medicine. So let me start with asking you about something you had said in a recent interview. You had been talking about how after working for years in fee-for-service, you were burned out. And I want to ask specifically, when you started practicing, given what you shared about when you were 5 years old, what did you expect to be walking into as a family medicine physician after residency? And how did it change over the years for you?
Oh, that's a really good question. Yeah, I think my story is not that different from a lot of people that go into medicine. We want to help people. We have this sense of being able to contribute to society and to really make a difference in whatever way we can, whether it's saving lives in the emergency room or consoling parents of children that are sick, to sewing up lacerations, whatever it is. We have really, really good intentions. And then I think throughout the time and the hard work and being sleep deprived and stressed out and being pulled in 100 different directions at the same time, you start to lose a little bit of that joy and the feelings of satisfaction that you get from providing that care for people. And so that's how I started feeling. And when you say burnt out, and I'm a little bit older than I think some of the other docs that you've been having on this podcast. And I finished my residency in 1999. And I think, I thought I would just go out into the real world and continue doing what I love to do. I stayed on as part-time faculty, teaching med students and teaching residents. But then I was also in a private practice with one other physician. We eventually brought on another one. And the paperwork and the overhead and all the other things that you had to keep track of, coding. And you can't help but it distracts from the purpose and what you're trying to accomplish, because you have to do it. And I think part of the program that I trained at was so phenomenal in exposing you to all different clinical situations, but doesn't teach any business, right? Doesn't teach you any of what you need to know to be a private practice owner. And we don't do business very well as physicians. We all know that. So I think that I learned through process of errors and eliminations and things like that. And now, thankfully, I'm in a business that's simplified because that has eliminated the insurance aspect of it. But here I am, it's 25 years later. So you learn with experience, but you also try and eliminate some of the headaches. So that's kind of gives me the space to go back to clinical focus.
I love that. And it's interesting that you talk about how, you didn't have business as an elective in medical school. We didn't have that incorporated into our curriculum in 99 or in 2011. So it's like, I doubt that that's also included in a lot of med schools even today. I was asking my dentistry friends, did you guys have business? And they were like, no, but we know that it's a business that you have to open up, typically your own clinic, yada, yada, yada. And I was like, it's so interesting how even just expecting to be a business owner after dental school versus expecting to be an employed physician after medical school and residency create totally different mindsets when we are going along our career paths. And the other thing I was thinking about was Dr. Tim Blakey, who was one of my dear mentors in Superior, Nebraska. He told me when he and his partner opened up the clinic back in, I think he graduated Creighton 79. So he opened a clinic in Superior and he was like, these codes, like we didn't know that there were codes for things. And so we totally missed out on a lot of revenue because we didn't know what we were doing. And it's so interesting to think back as to like when you were doing your private practice as well as working with the residency, and you're still saying you didn't really know what to do in terms of all the coding stuff. It's so interesting because people who are going into residency now, they still don't know what the heck they're doing. I mean, it speaks again to that we don't have business training. We're not prepared for how the business of medicine is run after medical school and residency. So with that, I want to ask, because you have amazing experience going from fee-for-service, working with the residency, to then a stint about 6 years in concierge medicine with 2 different companies before opening your DPC. So I want to delve into this time when you were going from fee-for-service, working with the 2 other physicians, into Partner MD and then WellCare MD. How did you decide to make the change from fee-for-service into concierge care?
Well, yes. So by the time I had made that decision, I probably worked maybe 3-4 years longer than I should have in the fee-for-service model. I was pretty burnt out. I had a panel of 3,500 patients, and not as many as my colleagues were seeing in a day. I think my limit is really 20 to 25 patients a day. Anything beyond that, I would start to really just not be able to stay on top of things. And even then I was struggling. And so by the time I left that group, which I highly respect my colleagues, and I'm still close friends with some of my former partners, I was ready to quit medicine altogether. And I was trying to figure out what I was going to do instead. And I couldn't figure it out. There was nothing else I wanted to do other than take care of people. But I couldn't see how I could make a living doing that. But I just, by luck of the draw, there was a Partner MD, was a concierge, which I say this in the bio, but a concierge model practice in Richmond, Virginia, was expanding to open offices in the Midwest, and was recruiting physicians to open one in Chicago. And I just answered a postcard and wanted to find out more about it. I mean, it was either that or MDVIP or one of the other, or some other similar type of concierge model practice. And there weren't as many back then as there are now, but still not that as many options. And I think I was hesitant to do it because I had to eliminate a good large 90% of my practice that I'd taken care of. So that speaks volumes as to how burnt out I was and how much I wanted to get out of that model, and felt that it was worth it to make the switch. So after about a year of my hemming and hawing and researching and trying to find something else to do, and them vetting me and figuring out if I was the right fit, then I opened up the practice and did that for not that long, maybe a couple of years. And just turns out that Partner MD changed over executive leadership and allowed me to step aside, and Welcome MD formed as a result of that, kind of branched off. I thought, well, I could probably continue to do this myself in that format, and stayed concierge and kept some of the patients, and then grew again a little bit. And then eventually I got tired of just, and I learned about direct primary care kind of maybe a couple years after switching to Welcome MD and doing it on my own with a business partner, and then learned about direct primary care and how great it would be to not have to still bill insurance. And I always felt that was a little bit, it didn't really make sense to me. How could I make it make sense to the patients to charge a membership fee and bill insurance, and then still bill for whatever was not covered by the insurance after the fact? So it just didn't make sense to me. It was a hard sell. And so when I switched to direct primary care, I eliminated that altogether, renamed, reincorporated, and then was able to stay in my office and kept the same patients, and just opting out of Medicare and doing it all this way. And it's been great ever since.
Awesome. And I'm glad you mentioned that because I wasn't sure. I was going to ask you, how did you transition and did you have a space? But when you talk about that you decided to close your practice under the Welcome MD, when you transitioned your office from working under one company to then opening your own business, how did that work? Because like you mentioned with Partner MD, they said, "Hey, well, you can do your own thing." It didn't sound like there was a lot of drama with regards to territorial behavior over patients. So was there any lessons learned from going from Welcome MD into your own DPC when it came to negotiating anything in your contract so that you could open up your own practice in the same space?
So I think I've been very fortunate in my situation. The only time that I had a non-compete that I had to honor was when I left the fee for service group and went concierge. I had a mile radius. So I actually had to move offices out of the area that I was practicing in. So that was a challenge, but it was a challenge for Partner MD to kind of deal with, right? And I think maybe that was part of the difficulty in the decision to kind of part ways in terms of that. And then by then, my non-compete had expired and I was able to move back to Oak Park where I had trained and been practicing and started Welcome MD in Oak Park. And I think switching from Welcome MD to Progressive Health, which is where I'm at now, I was able to, negotiate staying in the same office. The circumstance is a little bit unique, and I'm still friends with the higher executives that involved and my former business partner and all that. So I think I was just fortunate to have people who knew that it was a win-win situation to kind of just have that happen. And I was able to, keep my patients. And now I know that is probably a unique situation that a lot of other physicians have not been able to manage.
Well, that's what we love. Everybody is unique and everybody's sharing their story and they come from different places. So I love that was the case because it says to me that the people who run Welcome MD do care about patients rather than we care about our territory and protecting the money and the codes that come in from our territorial patients or our patients within the territory. So when it comes to you opening your direct primary care practice, how did you go about planning to open? Because you're still taking care of the same patients, you're still in the same space, but did you have to purchase the equipment from Welcome MD? And how did you announce to your patients like, hey, still Dr. Liu, still going to be here, but we're going to be a different model going forward?
Right. Well, I mean, essentially it was a rebranding altogether. And fortunately, patients stay with the doctor. They don't stay with the business, right? They know and trust whoever is taking care of them. And I don't know that it was that difficult, to be honest. We sent out like letters and emails and changed the name, changed the brand, made the announcement and said, we are now Welcome MD is not part of this practice anymore. We are now Progressive Health Primary Care. And here's the big difference. It did take a little bit of explaining because concierge medicine is actually not super, super mainstream or popular here in Chicago area. There are certain pockets where it's well known. And then direct primary care is probably even less known than concierge medicine. So it did require a little bit of kind of explaining. But then I was fortunate that my patients were already used to paying a membership fee. So there is retention there for sure. And then I ended up being able to grow from that because I think personally I felt like it made more sense. And then it was easy to kind of pass that along. And then I returned to I was still where I was practicing before. And then I was able to market that again. I will say that probably the toughest part of having the business is not the medicine part. It's the marketing part. I'm not used to advertising myself or marketing myself. That was taken quite a bit of getting used to. I'm still not comfortable in like cameras and interviews and podcasts and whatever, but it's part of what you have to do. And I think if you believe in what you're doing, then it resonates and people certainly appreciate that. And I think that that's how it works better. So in terms of like the purchasing the equipment and stuff. I think it was just like a nice, clean agreement that was drafted up, and we were able to, I took over the lease, and then it just was kind of straightforward.
I love it. Again, I'm so grateful that that was your experience, because again, it's like you just want to do medicine, and the fewer roadblocks that you have in your way to do medicine between you and your patient is wonderful. So I love that. When you talk about marketing to your patients, marketing your new practice to your patients under the new flag of progressive health, I want to ask, what did you find most helpful that patients understood more easily than other statements when you were talking to them about the transition?
I think what we try and say to them, I mean, we've used all different terms. People say, oh, it's like Netflix for medicine. You either use it or you don't, and it's the same price. And you try and like make analogies, or it's like car insurance, but it's really not. It's more just that we tell people, I don't want to have to worry about what's covered and what's not covered. I don't want to have to worry about sending you a bill later. And we help you budget, and everything's transparent, and you can understand what the costs are and what you're getting out of it. And there's no, the decision making is in how we take care of people, and not having to worry about all those other things. And it does take a while for people to kind of grasp, because it is a different concept. But then once they get it, they get it. It makes perfect sense. It's so much more simplified. And then on top of that, I can dispense medication out of my office. I save them tons of money that way. And like the labs are transparent, all the things that when you start describing, well, if you want to bill insurance, it could be this much. I don't know how much of it could be that much. There's no way for me to tell. Or you can just go with our transparent fees, and this is how much it'll be. And you can roll the dice, or you can say, this is it, and be done. Clean, easy. And so that makes it easier for them.
It's interesting because you're dealing with a patient population that was used to you as a concierge doctor. So I'm assuming the fees for membership were higher than they are in DPC, just because typically concierge medicine is for people with more means. And so even to have people who might have more means think about, oh, like, I'm still not understanding this DPC thing. Like, how does this make sense for me? It's interesting that your patient population, given that they were in a concierge model before with most likely higher fees than a DPC membership, I love that those conversations were still had, rather than like, whatever, just send me the bill, because everybody deserves transparency, no matter if you have means or no means. And I think it's really, in my opinion, it is really taking advantage, because you're double dipping when you are doing a high fee, plus you're still getting these surprise bills that you didn't expect to get, that are way higher than, in a lot of cases, like labs, for example, than you would have gotten if you would have just paid transparently. It's something that definitely, as a culture, this country is getting exposure to more and more. Like, hey, wait a minute. Yeah, the insurance thing, it's not actually equal to healthcare. And it's like, yeah, that's correct. Because the doctor is giving healthcare. Right. That's what healthcare really is. And really, if we look at like what medical school is and what doctor school is meant to do, is meant to create people who are actually trained to take care of others. One of the things I wanted to mention here was something that you mentioned in this recent interview that you gave, was this whole idea about you had done an abscess IND and the insurance didn't cover it because you're not a specialist. I was livid when I heard that part of your interview, because it's like the patients, again, it's like they're like, oh, Dr. Liu is a physician and surgeon, so that means she can do these things because she's sure as heck trained to do them. But my insurance doesn't cover that. How does that even make sense? Like, it made me livid. And patients, when they find these things out, like I remember I told Dr. Shannon Scholl this, she's a gastroenterologist in Raleigh, North Carolina. I told her how I did a colonoscopy and it went from screening to diagnostic the second I took a polyp out. And then she got a $7,000 bill, and she was calling the office every single week. Like, can you fix the code? Can you fix the code? I'm like, dude, I'm not the one who's putting in your code. It's literally, I just did the procedure to take care of you and to screen you for colon cancer appropriately. So us being doctors and being able to do our jobs is so valued by so many people, and whether there's means on the table or not.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Right. Yeah, sure. If they have the means and then they're able to pay the concierge fees or membership fees or whatnot. But they still think about it, but you still don't want to be paying more than you need to. And now with the direct primary care, I think I didn't lower my fees very much. I just created kind of tiers, which in concierge medicine, that doesn't happen. And so if people understand that their membership is actually covering, is kind of going towards the care that they're getting, and that's basically all that the physicians take in, they don't realize that when before in a fee-for-service or in a concierge practice, that the doctor is not getting that, whatever that cost is that's coming back from the insurance company. And people are floored by that. They don't realize that it's the facility and the overhead and all these other things. And the physician isn't taking any of that home. And it's really eye-opening to some people. And I've had some people say, you don't charge enough. You should charge more, because it's like you went to medical school and you got all this training and you work really hard and you're available 24 hours a day. You compare it to some other lines of work that are not medicine. And I think a lot of direct primary care doctors do undercharge, but it's okay. We're in it to help people. We're not in it to make gobs and gobs of money.
But as people are showing with patient panels that are reasonable, when you give quality care and you have people who are seeking that care, this is why DPC is growing all over the country. And we do have people who are, depending on how they set the pricing, if they charge for one-off services or not, they're still able to make more than they did in fee-for-service without all of the burnout associated. With that said, tell me about who has joined your practice since you went to Progressive Health, because like you said, you didn't really change your pricing much, but the model of DPC has allowed you to see people who are coming from all sorts of economic backgrounds rather than just those who have high income means.
Yeah, I think probably the largest proportion of my patients are, surprisingly, they're either small business owners themselves that have very high deductible plans and end up paying out of pocket an exorbitant amount of care. And even if they don't have health issues, it just ends up being cost prohibitive. Some have opted to go without insurance altogether just because they take that chance. I don't encourage it by any means, but it's a choice that they have and they make. And then I have Medicare patients, believe it or not, who are aging and have maybe a few concerns, maybe a lot of concerns, maybe are complex, maybe are the physicians in the fee-for-service practice don't have the time to explain things. And it's not even just Medicare patients, all of them, but it's, people are frustrated and tired of not having their questions answered and not feeling like they're being heard or being cared for, sitting in the waiting area for 2 hours and meeting with a doctor for 10 minutes. It's the same story over and over again. So I think really in the past year, I think since the pandemic, has exposed so many issues with the healthcare industry, and doctors are stressed and nurses are stressed. People are starting to understand that they have a choice that they can make and move over to a practice and with a physician that has more time for them. So they're seeking other options. And so it's run the gamut, but certainly I somehow got on some kind of mom's list for college students that are without a doctor because they've moved to the Chicago area or whatever. And a couple of patients signed up with me. And next thing, all these people are calling, not tons, but like, hey, are you still taking patients? Because my kid, such and such school, and needs a doctor and loves that, like, they need something, they can just call and I can do a video appointment, or it doesn't matter what their class schedule is. I can like squeeze them in or whatever. I mean, it's so easy. So that's kind of, and they're probably healthy and don't really need a lot, and except for an occasional check-in, and or if they've got a COVID test or a strep test or whatever, it just makes sense for so many people.
I love that. And that's one of my favorite things when I hear people like DPC doctors, our fellow DPC doctors, send their college kids to enroll in other DPCs because they know what their kid's going to get, rather than like relying on like, who's at the health center? Like, can I get a hold of anyone at the health center? It's like, no, you're going to go to this DPC doctor who's my friend. So I love it. I love it. And when we talk about young, healthy people, you mention it on your website, who is direct primary care good for? And I love that you found, as I found in my practice, that people who are healthy and want to stay that way. That's what I loved on your website. It's so true. And I love that there was really a culture change in the patients who joined from my fee-for-service practice to Big Trees MD, in that those were the people who were not there because, oh, I have to see you, so Medicare covers me, or they were worried that Medicare wouldn't cover them if they didn't come for their annual physical, or they were like, I never want to come to the doctor, but I have to come now because I got discharged out of the hospital and I had to find a primary. Like, I love that my patients are, for the most part, they're just like, hey, like, I am not in a critical situation and I'd like for me to partner with my doctor so that I'm out of those sticky situations as much as possible. And it's incredible. Like, especially when it comes to older people with chronic medical issues, it is amazing what just simple access, how much of a difference that can make in somebody's life.
So true. So true. I mean, I think that's another thing that I definitely ran into when I first started having a concierge model practice. I think it was suddenly, all these people are just happy to have access. They're more, I think, proactive about their health because of that, because you're paying into something. But it's also this mindset of, okay, I don't have to save up a problem list of 10, 15 questions because I can only get into my doctor for 10 minutes out of the year. And they're like so busy to try and hurry up and get all their, and they save it all up for that one visit. And I try and tell them, well, you just email me or call me if you have a question, and let's knock it out and be done with it. Don't wait until you come see me in person, because that's the old mentality. You don't have to do that. And people think, wow, how refreshing is that? That if I see something that I thought might be interesting, can I just ask you about it? I'm like, yes, please. I don't want you to try it without asking. So yeah, it's definitely more the relationship that I always expected to have with my patients.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
Love that. Now, let me ask you about SEO, because you trained in Oak Park. You were around the Chicago area when you were in concierge. Then you went back to Oak Park between Welcome MD and Progressive Health. So in terms of your SEO, did you have any issues like claiming your Dr. Ingrid Liu profile? And do you have any suggestions for people who are still within the same area, might be practicing going from fee-for-service into DPC and maximizing SEO while they open DPC?
Oh my goodness. I have a very good person that does my SEO. And I've learned that's another learning curve thing. Yeah, there are still, of course, search engines and Yelp or whatever that are under my former practice names and whatnot. So I was very lucky to be able to keep my phone number and my address and all that. So that made things a lot easier. Been trying to claim one of these other sites for a long time, but you have to ask them to cancel and blah, blah, blah. So I think that my marketing person would love for me to say that reviews do matter. I fought him on that for a long time, but it does push up your search engine stuff. For Google, for sure, it makes a big difference. People read the reviews. It helps boost your standing or whatever. And so I guess right now we're actually, because I have two offices, my main office is in Oak Park, and I have like a satellite office by appointment only in downtown Chicago. And we're trying to figure out if I need a separate review page for the Chicago office. But it all depends on if I am wanting to grow that location more. It's wild. This is stuff that I never thought I would be even talking about as a physician, but it is important because people want to be able to, you want to be visible and they want to find you. So yeah, every once in a while, someone says that they're looking for me and they found that I was working at some practice that I haven't been at for 15 years. Are you still at such and such address? I'm like, no, but they eventually will find you I'm fortunate that because I've practiced for so long in the same area that it's pretty easy through word of mouth and through however many different listings there are that they eventually find me. I'm still listed in all the insurance booklets. So it's been 3.5 years since going DPC. I sent all the letters out, but people are still not as many as in the beginning, but many people were saying, I found Dr. Liu is listed in my insurance. Can I come make an appointment? It's never going to end, I don't think. But that's okay. Draw them to my practice. We explain the model. My office manager is fantastic at taking the time to describe DPC, and some say, oh, no, thanks. I'm going to use my insurance. And others say, oh, tell me more. And then you just kind of start that.
I love that. And I think that that's one of the things that, as you talk about being comfortable more and more with marketing yourself as a physician, talking about the model of DPC, when we get the same questions or like the same fears or the same, like, how does it work type questions, like, would it work for me type questions? I think we also think about patients who fit into those categories, and it makes it easier to talk about or to answer those questions. In our meet and greet, I guess, link for people to self-schedule their meet and greet, we have included questions like, how did you hear about us? And what are you looking for in a doctor? And so it's very interesting from even those questions to go into meet and greet. And for me, that's how I've kept down my time. It used to be like 21 minutes, 25 minutes sometimes, how I keep it down to 15, because I know exactly like what they're looking for. And some of them are just like, I want to know more about DPC. But I love that people who are engaging because of search engines like Google, I really am finding that most of them are very open to I generally get the feel of what's on your website. So you're telling me generally this is different from normal fee-for-service medicine. So what does that mean for me? And I love that they're asking that, because most of the time, those types of people, and I don't know if this is the same for you, but most of the time, those people, as soon as it's like they think they know what DPC is. And then when they hear those keywords like transparency, access, they're like, bingo, like, where do I sign up? And so I love that through experience. And like you just said, you're past 3-year mark, which is awesome. We slowly get this confidence to keep going and marketing ourselves. And I think it really helps when we are marketing well, our patients understand our value proposition and how we describe it. And then they trickle that down to their friends and family, just like the college students.
Absolutely. Yeah. It is true that whatever that calculation is, that the 3-year mark is when you really have to do very little marketing and it's mostly word of mouth, because that is for sure the case, either just by a sense of how new patients are coming to me now. Every once in a while they say, well, yeah, I talked to you about a year ago and I didn't understand it. And now I just can't take it because I haven't been able to get in with my doctor or So there's all different scenarios, but people really, once they see what they are able to achieve and that they can act. Sometimes I answer the phone. I mean, I have one staff person, and so if she's busy, I answer the phone, and they go, "Oh, did I call the wrong number? I'm sorry, I didn't mean to call your direct number." I'm like, "There's one number. There's only one number," and they get so surprised when the doctor answers the phone, and they go, "Oh, okay, I won't take much of your time." I mean, it's just really, really fun to see.
Those are such fun moments. Like I even in meet and greets, when it's like on our practice previously before my husband joined the practice, it said meet and greet with Dr. Conception. And so they're like, the people would come onto the meet and greets and they'd be like, "Oh yeah, so does Dr. Conception do, or does Dr. Conception see?" And I'm like, "Yeah, like I'm Dr. Conception." Like they expected to not have the doctor even during the meet and greet. So funny. Yeah. Tell me about when going with this theme of transition, when you transitioned to your own DPC, did you change your tech at all, your EMR or your phone service, anything like that?
Oh, yeah, I had to change the EMR. Absolutely. Am I allowed to say? I don't know. But I had a more standard, like next gen Athena. I can't remember which one it was. It was like a big, not Epic, but it was a big major EMR. And then without needing the coding and all that stuff and the insurance billing, it just, so then I went more simplified and did a little bit of research, and of course reached out and got a lot of guidance from other DPC folks, which is so fantastic. That's another big difference, I think, between the DPC community and the fee for service realm. I think physicians are so stressed out and burnt out and whatnot, and taught that you don't want to help the competition. It's just like a caustic environment or toxic environment. And coming to DPC world, everybody wants to help everybody. It's just so refreshing. And I was able to get all the information I needed from anybody. And I was able to kind of research a little bit and find what matched my needs. And it's been great.
Awesome. And when you made this transition to DPC, given that you didn't have an MBA, you were learning business a little bit with each concierge move and then opening your own DPC, do you have any big tips from your experience that you want to share with the audience when it comes to being a business owner and a physician?
Well, I think, depending on who we're dealing with, everybody has their talents and their strong points, right? And some people are more business minded than others, and you can't do it all. I think for me, I allow my office manager to help me out quite a bit. I wouldn't be able to do it without her. I'm very fortunate to have. She does everything in terms of a lot of the business running and the billing and the memberships and the ordering supplies, and then also rooms patients and does EKGs and whatever else. So she's a diamond in the rough. And so if you can find somebody like that, that is to hang on to that person. And I probably, maybe I do spend money on the marketing aspect, which I suppose I could probably cut back on, but it's valuable to me to continue to have him help boost those things. And I outsource some things when you can't do it all. And if you feel like you need some help, to ask for it. I think that's probably the biggest thing that I've learned through experience. You can read all you want, but talk to people that are in it and that are doing it. I'm happy to pay it forward and try and like not have people make the same mistakes that I made. I think, in private practice, not only were we coding incorrectly, we also had billers that were not good and not telling us that we were coding incorrectly. I mean, that you want to surround yourself with good people who are happy to work for you and help you succeed. Like give them some kind of, not incentives, but ownership in the practice, and just kind of surround yourself with people who are happy to be there, and because it is a lot of work, no matter what. And I think that's probably my biggest tip, because the medicine stuff, you get to it, you do it, and you have more time to research and figure out what the next step is, and you don't have to answer it all in one visit. So that kind of is freeing and gives you more time to do some of the business stuff. But if you don't like it, you don't have to do it. You can find somebody else to do it for you. It's not necessary. I mean, And I think that there's different ways to run a DPC practice. I think that's also nice that people get creative. I don't do colonoscopies. I don't do like major procedures. I definitely, wouldn't want to do that. And other people do a lot more procedures and cosmetics and things like that. It's just, I think if you're in the scope of what the standard of care is, fantastic. Just do you, and that's the people, and not try and change who you are to meet what people want. You'll draw the people to your practice.
Love it. When we talk about creativity, I want to ask you about workflows, because I'm going to ask you about your add-on services that you have at your clinic. But in terms of workflows, because you went from these different models of care into your own DPC, what workflows are you proud of to make your patients have that great access, but also so it saves your sanity when you're like not having to look for certain things or do duplicitous work in your practice?
Oh, that I could probably still improve on, to be honest. I think probably, because there's only one other employee and myself, the communication's much better. I mean, making lists and like kind of making sure that everything is done is a lot easier than when you have a large 4-person practice with all their staff and like having to triage and blah, blah, blah. We don't have any of that. And so messages and refills and things like that are pretty straightforward. All that kind of comes to me. And if I need my 1-person staff to do something for me, I just send a little note and it gets done. I think we have electronic fax instead of paper fax. That was like thing that I changed from, believe it or not, from concierge medicine to direct primary care. So all of that goes immediately into the person's chart, or both she and I see the faxes instead of one person being in charge of like pulling it off the machine. I mean, it sounds so simple, but it really is that. It saves a lot of work. And also, like if somebody misses one, then the other person gets it. So that's one example. We kind of check each other's work and making sure documentation. I think ordering supplies too is another one that we could probably, keeping inventory that's a little bit more cumbersome from an aspect that could probably figure out a little bit better way of that, to be honest. But in terms of patient care, it's way easier, even from the concierge model, because it was from the concierge model. If you're billing insurance, you still have to document and make sure that everything, the T's are crossed and the I's are dotted, and that you've checked all the right boxes. And so it's just, and there's none of this quality care, blah, blah, blah. Medicare physicals, like you mentioned, all those things that you have to make sure, and chronic care management and all those things that are part of insurance. So with DPC, we just make sure that we have everything where it's supposed to be. And yeah, it's much easier.
I think it's so important that you mention it like you did, though, because one, for those people who are even still on the fence about like, oh, but it must be so much work to run a business. It sure as heck, like you said, is. And I agree with that. However, there are ways that the business can be streamlined so that you're doing it, you're learning from it, you're fixing it, and it can be that way for a very long time. And like you said, you're not adding that insurance layer to it. So the like 14-point review of systems, what is it? I used to be able to pump this out, and now it's like negative unless otherwise noted in HPI. Like never have I had to say that in DPC, and it's amazing. Oh my gosh. Oh man. Yeah. But I also love that when we really zoom out, reading into what you've said is like, you literally are just able to do the things you need to do to be able to take care of your patients and not take care of the insurance company at the same time. So with that, when you talked about your main office in Oak Park, and then you have a satellite office in Chicago, how did that happen? And did that have to do with the add-on services that you have in addition to membership?
No, I think that actually started when I was still doing concierge medicine. And I had a lot of patients who would live in the suburbs and work in the downtown city area. And some of them wanted like executive physicals as part of their membership. So it was easy to to have like that downtown office for convenience for those patients. But then when the pandemic hit, which was the same time that I decided to go direct primary care, nobody was working downtown anymore, and nobody was going into a high-rise building. and nobody was commuting and nobody was, So we shut that second office and kept the Oak Park one, never closed the doors, and always just managed everything and ran telehealth or whatever. And then once things started opening up again, my patients that live downtown or started commuting downtown again, it made sense to try and have, just for convenience, a location there. And so you mentioned the services that I do. And so the cannabis consultations continue to be high demand. There's not a lot of physicians that have the freedom to offer that if they're employed by hospital systems, because it's frowned upon, even though it's totally legal, recreational, and medical in Illinois. But if they're affiliated with Medicare or other government funded facility, it's still not something that they can prescribe or recommend or whatever. So I have been getting a lot of referrals based on my knowledge and involvement in that. And so they were coming from all over, and still do, from far suburbs to in the city and stuff. So I do that quite a bit. And but mostly it was for patient, just kind of access to care. Mm-hmm.
Love it. And as the pandemic has gotten to a point where people are returning to the city, to commuting, et cetera, how is your week split up now that you have both offices?
Yeah, so I think the majority of my patients still go to the Oak Park office. I mean, they know that that's where my hub is. I basically tell them that they can, and it changes depending on availability or whatever, but I sublet the space from another physician that is actually a surgeon. I mean, she's not a family med doc. And so when she's not in the office is when I can be there, though there is enough space for both of us. It's a really nice location. So we tell people, I can be downtown on these days of the week. Pick one of those days if you need to see me. And so it's not ideal for people who get sick on a day that I'm not down there. And I'm not sitting down there if I don't have patients, right? Because I'm always needed in Oak Park. So sometimes I end up just doing video appointments because that doesn't work out. And then other days when I have one patient that says, oh, can you see me on this day? Then we start calling people that we know are located downtown and just, or sending emails to say, hey, Dr. Liu is going to be in the office on this day, FYI. If you need something, let us know or whatever. And I usually do a half day there and split the day, or I'll do a whole day one. But the phone calls all ring in the Oak Park office. Yeah. So there's not and my staff doesn't go with me downtown. The staff stays. So it's easier to have one location. And then I just bring my laptop and have my cell phone and do everything from downtown. Yeah, that way.
So freeing because sitting in an office from 8 to 5, or my husband and I would do 2 full days and then 1 half day. And then we would switch and the other person would do 1 half day and then 2 full days to end of the week. And there would be days like snow days where I'd be like, why am I here? Like, why can't I work from home? And we learned, like you said, the pandemic really showed our whole country how there are issues in American healthcare. And one of those was access to telemedicine. I love being a DPC doctor and setting boundaries when it comes to yes, we can actually manage this over telemedicine. You do not have to physically come into the office to review your labs. I mean, clearly, if you cannot hear me over video visit or whatever because of hearing issues, no problem. We'll talk so you can read my mouth or whatever, or I can talk louder in person, but it's you have the options. So I just love that. That's how you've made it work for your patients. When it comes to boundaries, I'm talking about, because you have come from concierge into DPC, how have you been with regards to setting boundaries? Have you strengthened your confidence in setting boundaries with your patients over time? And if so, how?
Yeah, that's a great question. I definitely have been better at setting boundaries. And part of it is out of necessity. As the practice grows, I don't have the time to sit and chat with someone for 2 hours or whatever. And not that I do that, but my accessibility is still there, but I need to give everybody equal time. So now at the meet and greets, set expectations and say, it is just me 24/7. And so you just keep that in mind, that if you are wanting something, an answer quickly, that you should call and leave a message. So many people call and hang up, or won't leave a voicemail, or text, but then don't say what. I mean, it's just, so you have some people you have to really, really lay it out. And other people, I say, look, if you're calling me at 2 a.m. for something that could have waited in the morning, that only makes me tired and crabby for everybody the next day. I've gotten to the point where I'm not afraid to say that. And it just helps them understand, oh, you mean if I call you, you're going to answer? I'm like, yes. Or it's such a concept, and they text in the middle of the night thinking I won't see it until the morning. I go, well, I can't exactly silence my phone, because if it rings, and so sometimes it's a little bit of training, and sometimes and I used to think that would be asking, like being rude or whatever, but now I realize, look, it's for everybody to feel better about knowing like what I am there for, and what's realistic and what should be helpful in the long run. Otherwise, I'm not going to ever answer any of your questions, because then it just makes me bitter. But people, yeah, you do have to lay expectations and boundaries. And sometimes it works and sometimes it doesn't. Sometimes people have a hard time changing their behaviors, and you just have to understand where they're coming from. And then the communication like helps open up a lot of like other things that you realize that are happening in people's lives. And I have time to do that, and that's fine. So, but yeah, you definitely need to say, okay. And people, that's one thing. Like, I don't have regular evening or weekend hours, but if you work and you can't get in to see me during those hours, I will make an exception. And some people are like, oh, no, I don't want you to stay late. I'm like, well, when am I going to see you then? I'm never going to see you. So I say, I can stay late. I'll be here till 7. Come in. It's no big deal. Or on a Saturday morning, I'll meet you at the office. It's no big deal. Just tell me ahead of time. I'm not going to be here every Saturday morning. I'll just make an exception. And people really appreciate that.
They totally do. And I love that you're talking about that, because with us owning our own practices and us being able to set our hours, I feel that that's why some of my younger people especially have joined the practice, because they're like, wait a minute. Like, I get off at 5 every day from school or work. And you're telling me that like, if I needed to see you, I could actually come in after work. And I'm like, yes. And they're like, is that part of the membership? And I'm like, yes. And so they're like, oh my God. So yeah, it's really great. But I do agree with you also that anxiety that happens initially when patients join onto a DPC practice, it does go away. And then that's also something that I found our patients are really proud of. They're like, oh yeah, I don't have to like have my Santa's list of problems. Like, I just have to have my one question, and I can just put it in the portal or put it in a text or whatever needs to happen, so that I can get my questions answered. But I don't have this anxiety of I can't get in to see my doctor. And for me, it's like, not only is that right, like my righteous rage is coming out, but also I think it's so awesome. Like, I get this feeling, and I'm sure you do too. Like, I was able to help more people in a better way without having like, I have to now answer 15 questions in a message because they had to bank their questions until the one day they could see me, or the one time that I would read their email. So DPC is just amazing all around. Oh my goodness.
Yes, absolutely.
Now, when it comes to access, I want to ask, because you also offer medical abortion services and you also offer medical ear piercing. So when you have patients who are coming to your practice and coming to see you for these services, including medical cannabis, how do you turn on and off the access when it comes to after hours care if they were to have like complications from procedures, not necessarily or medical cannabis, but when it comes to like the abortion services and the ear piercing services, how do you distinguish access between a member and somebody who's coming to you for a one-off visit?
No, I don't really distinguish between that. I mean, it's pretty clear ahead of time when they make the appointment that they're not members of the practice. And so they're only coming to me for that one reason. If they want to ask me about anything else, or if something that's not related to that, then they have to join, or they go back to their regular physician or whatever. And so that's kind of laid out. And that's a fee for service, right? So it's a one-time fee, and it's not. And sometimes it'd be cheaper for them to be a member than it would be to pay the fee. But I haven't run into that, to be honest. Thankfully, it's laid out in terms of what I'm available for anyway for emergencies. And so absolutely, I wouldn't want to discourage someone from calling if it was something that was related to that. The medical cannabis is a little bit trickier. They're clearly coming in for a consultation to help them either choose wisely or get certified or whatever. And if they're still having issues and they're having medical conditions that are having to be managed, usually it's related to that, then I say it would just benefit you to join my practice and I could do all that. And I have gotten quite a few patients that way. Yeah, because they want a physician that understands the pharmacology and understands the risks and the benefits and how to adjust their medications and that kind of thing. So that's one thing. But the medical abortions and the piercing, I mean, obviously that's like a one-off thing.
Awesome. And I love that you mentioned that also, because a very common question that I get from physicians or residents or medical students who are learning about DPC is like, but you're on 24/7. Isn't that draining? And when patients don't have the anxiety of, I can't ever get a hold of you, they don't tend to email or text after hours. And I will say, like, I do agree with you also that there are some who need a little bit of like, hey, I'm going to remind you here that this is where the boundary is set. And like, I don't need a text about you need Tylenol at 10 o'clock at night. Like, you can actually go buy that at the Dollar General if it's still open. So I love that. And I think that that's really good for people to hear, especially if they're exploring DPC. Now, when it comes to family medicine, one of the things that you had written on your website was that you loved the specialty of family medicine because it allowed you, like no other specialty, to provide the variety of conditions, to provide a variety of the conditions managed, exposure to the complete lives of patients, and exposure to different cultures. So I wanted to ask, how do you maintain that full scope of care and those goals of being a family physician when you have a panel that's not 3,500 patients any longer?
Yeah. That was also part of the reason why I think concierge medicine was not a fit for me, because it did end up making the pool so small and did not give me as much variety as what I really missed that. Oak Park is and Chicago is extremely diverse, but Oak Park is a very special place, and in that it has a large range of different ethnicities and socioeconomic backgrounds and religions and different things. It's just kind of a unique community, and it's known for that. So everybody has room to grow, of course, but I've been fortunate that even with the smaller panel, that I still have a bit of variety. But it's interesting the answers that you'll get if you ask the right questions. So you think about, what was your upbringing like? If you came from a divorced home, or if you grew up in a rural area, moved to, and vice versa. It's just getting to know the patients and their histories and what they were exposed to when they were younger, that helps shape how they approach their healthcare now. Is such a big process that I think I still really enjoy. I mean, this is my favorite example, and I probably told this story before, but I had a patient for years in my fee-for-service practice. He followed me through to, I don't think he came along I don't think he joined when I was concierge, but then found me again when I was direct primary care. Anyway, came back to me. And so all together, I've probably been his physician for 20 years, right? And it wasn't until I was in the direct primary care office that he revealed that he, as a 50-year-old man, eats Captain Crunch every day for breakfast and struggling with some of his A1C numbers. And I'm thinking, how did I not know that you eat Captain Crunch as an adult? And why can't I get your A1C numbers down? But it's something that he's grown up, and that's like his comfort, and that's what so we had to work with that.
I love that. And I love that you've pointed out how when we talk about diversity, our patients are just as diverse as us opening DPCs. And I love that it's ironic that you're talking about this man and his Captain Crunch. Like today I was taking out sutures and I was like, so where did your parents meet? Like, where did your parents come from? And like, it's like, because what else am I going to do? Like be silent when I'm taking out stitches, or like turn on elevator music? Like, for me, the option is like, hey, let's just get to know you some more. And this is a patient I've been taking care of for now 8 years. So it's really cool. Like, I didn't know this. And it like, even just picking up stuff, like, even if it doesn't matter for that visit, you can totally piece other parts of the history together as to like, why does this patient do X, Y, or Z, or act in an X, Y, or Z way? So I love that.
Yeah. Or someone whose father was an accomplished writer and like won some major award. And I'm like, oh, that's so fantastic. I mean, there's all these different things that people really, there are parts of their lives that we only know a tiny part of. It's been fun.
Love it. So now looking back with your experience in choosing family medicine as a specialty, with you working with residents, working in fee-for-service, 2 different concierge practices, and now your own DPC, if you were to talk to your former self, graduating out of residency, what lessons would you say to your former self? And what lessons would you say to your future self, given what you know now?
You know, it sounds really, really cheesy, but I would say no matter what, it all works out. Just keep at it, follow your instincts. Don't do something just because you think you're supposed to do it that way. But I wouldn't go back and change a thing. I mean, the doctor that I am today is because of all those different steps that I took and all the different things I was exposed to and all the different people along the way. Yeah, I mean, even except that maybe I should have quit fee-for-service a couple years before that. I don't think I needed to yell at my kids nearly as much as I did during those years. I mean, that's something that I probably would have said, okay, you know what, if you're that miserable, waking up, dreading going to work every day, and it doesn't seem to ever get better, that's when it's time to make a change.
Love it. And with that, thank you so much, Dr. Liu, for joining us today.
Thank you. I enjoyed it.
Next week, look forward to hearing from Dr. Clint Flanagan of Nextera Healthcare. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.